Hello everyone, in this short lecture, I will discuss with you the serological marker of hepatitis B. Now, when I am discussing with you the serological markers of hepatitis B in this video, it is understood that you all are aware of hepatitis B virus. You know what hepatitis B virus is, what are the causative factors and what are its outcome, etc. In this short video we will only discuss about the serological markers of hepatitis B. So in the serological markers of hepatitis B, there are two main things which we look for. Number one is antigens and number two is antibodies. So this is also understood that you know what an antigen is and what an antibody is. So first of all, we will look for surface antigen. The first antigen is surface antigen. It is known as hepatitis B surface antigen. In short, we write it as hepatitis HBsAg. So this is the first antigen. Okay, it is found on the surface of the virus. For example, this is the structure of hepatitis virus. So on the surface of this virus, the hepatitis B surface antigen is present. Okay? It is released into the blood. When it is released into the blood, it is released into the blood during the time of incubation period. Once the person is infected with the hepatitis B virus, during the time of infection, during the time of incubation period, the virus will start releasing this HBsAg into the blood. So the next one is E antigen. Where it is found, the surface antigen was found on the surface of hepatitis B virus. The E antigen is found between the surface and the core. This is core, this is surface. So E antigen is found between the core and between the surface and the core. Okay, it is released into the blood during the time of acute infection. What does this indicate? If in blood there is E antigen, it is regarded as that the person is going through the acute phase of infection and the virus is replicating very fastly. So what does E antigen tells us? E antigen tells us that the person is in acute infective phase and the virus is replicating in the body fastly. Now talk about core antigen. The core antigen is present at the core of hepatitis B virus and it is not released into the blood. It is not released into the blood. Now, for what we have learned till now, we have learned three antigens. Number one was surface antigen, number two was E antigen, and number three was core antigen. Now to every antigen, our immune system will respond. And how will it respond? It will respond with the help of antibodies. So now we will talk about antibodies. Number one is surface antibody. In short, we write it as HBsAb, hepatitis B surface antibody. When does it appears? It appears in response to hepatitis B surface antigen. The hepatitis B surface antigen appears into the blood during the time of incubation period and around 6 months it goes away. So it goes away, then the hepatitis B surface antibody appears. In response to hepatitis B surface antigen, our body produce hepatitis B surface antibodies. Number two, E antibody. What does E antibody indicates? As I told you, E antigen is the marker of acute infection and it is the marker that the replication of virus is taking place very fastly. In response to this, our immune system acts and produce hepatitis B E antibody. And what does these E antibody tells us? E antibody tells us that the person is not in the infective phase, or we can say it is less infective because our body has started producing antibodies. These antibodies neutralize the effect of E antigen. Now talk about core antibodies. As I told you, core antigen does not appears in the blood, but the core antibodies appears in the blood. There are two core antibodies, IgM and IgG antibody. The IgM antibody is the marker of early phase of infection, and IgG is the marker of late phase of infection. So around 3 months, the core antibody appears around the 3rd month of infection, and in the later phase it converts into IgG. So IgM is the marker of acute infection and IgG is the marker of late phase of infection. So everything which I told you about antigens and antibodies, let's summarize it, and we will summarize it and try to understand this in the form of graphical phase. See, first the person get infected with the hepatitis B virus, and after getting infected, let's say 1 to 2 months, this is the period of incubation. Let this be the incubation period. Incubation. 1 to 2 month time is the time of incubation. So first of all, the surface antigen start appearing in our bloodstream. When does it appear? It appears during the time of incubation period, and in about 99% of the patient, it start declining or completely disappeared at around 6 months. It is at its peak during the time of infection. When the infection is at its peak, the hepatitis B surface antigen is also on its peak. Now talk about hepatitis B E antigen. E antigen is the marker of infectivity. For example, if we find in the bloodstream there is only hepatitis B surface antigen and there is no hepatitis B E antigen, then what it will be considered? It will be considered that the person is suffering from the hepatitis B virus, but the hepatitis B virus is not in the infective state. So hepatitis E antigen is the marker of infectivity. When does hepatitis B E antigen appears in the blood? It rises during the period of incubation time, and it is at its peak during the infective period, and by the time jaundice disappears. Jaundice is infection. If the person suffers from hepatitis B, he also suffers from the jaundice. Jaundice is the symptom. So when the period comes, then the jaundice declines. The hepatitis B E antigen is also starts declining in the blood, and it also disappears. It is at its peak during infective time, or we can say it is at its peak during the time of jaundice. So now we will discuss about the core antibody. As I already told you that the core antigen is not released into the bloodstream, but the core antibodies are released into the bloodstream in response to the core antigen. Now I'll try to make you understand this in the graphical form. See, look at here. As I already told you, there are two core antibodies, IgM and IgG, and I told you that IgM was the marker of early phase, or we can say acute phase, and IgG was the marker of late phase, or we can say it is the marker of chronicity. So now let's just see in the graphical form when does this appears. The core antibody are the response to core antigen. These appears during the 3rd month in the form of IgM, and in the later phase it converts into IgG. So there are two type of core antibodies, IgM and IgG. In the starting phase it will be IgM, and IgM will be regarded as the marker of acute infection, and the later after 6 months they will convert into IgG, and IgG is the marker of chronicity. So till now we all have understood three things: the surface antigen, HBsAg, HBeAg, E antigen. We have also talked about the core antibodies. Now talk about HBeAb, hepatitis B antibody. We already discussed about the E antigen. Now we will discuss about the antibody, hepatitis B antibody. When does they appear? They appear during the time of resolution of jaundice. When the jaundice disappears, as I told you, 3 to 4 months, this is the most infective period, and after this the jaundice disappears. So when the jaundice disappears, HBeAg, the surface antigen, infective antigen, also disappears. So when does the antibody rises? Antibody to E, hepatitis B E antibody rises when the jaundice disappears. How does jaundice disappears, or how does HBeAg disappears? In response to the hepatitis B E antigen, our body give rise to hepatitis B antibodies. So these antibody rise when the jaundice these antibody rises, and the rise of these antibodies lead to disappearance of jaundice and disappearance of infection. Ultimately we can call it disappearance of hepatitis B E antigen. Okay, now let's just talk about anti-HBs, antibody to surface antigen. As I told you, one of the most important and the early serological marker was hepatitis B surface antigen, and during the time of 6 months, in about 99% of the people, the surface antigen completely disappears. And after the disappearance, or how does these HBsAg disappear? These disappears due to the immune response by our body. And how does our body response? Our body responds in the form of anti-HBs by producing antibody to surface antigen. So the surface antigen, the antibodies to the surface antigen appears around 6 months in response to surface antigen. Now one more thing which I want to tell you is, that is the window period. See, this is called as window period. How will you define the window period? Window period can be called as the time between the disappearance of surface antigen, the disappearance of HBsAg, and the appearance of HBsAb. So what is window period? Window period is the time period between the disappearance of hepatitis B surface antigen and the appearance of hepatitis B surface antibody. These are the disappear. This is called as window period. Now we will do a short exercise. This exercise will help you remind whatever I told you in this little video. See, number one question: early and the most important serological investigation, or the serological marker. I told you in the video which serological marker comes most early. Try to remember. What was it? It was surface antigen, HBsAg. So what will be the answer of this first question? Early and the most important serological investigation, or we can say marker. Which one is? It is hepatitis B surface antigen. Now we will talk about this marker of infectivity. I already told you which antigen is the marker of infectivity. Try to remember. I told you about this HBe antigen. When does this appears? This appears during the time of incubation period, and it is at its peak during the time of infection. I already told you that hepatitis B antigen is the marker of acute phase, and it is the marker that the virus is replicating at very fast stage. So what will be the answer of this question? Marker of infectivity. Which serological marker is the marker of infectivity? It is hepatitis B E antigen. Now resolution of infection. As I already told you, that marker of infection is E antigen. So what will be the marker of resolution of infection? Obviously it will be antibody to E antigen. So anti-HBe, or we can say hepatitis B E antibody. Hepatitis B E antibody is the marker of resolution of infection. Now what is the marker of acute infection? we already discussed that core antigens are not released into the bloodstream, but the core antibodies are released as immune response. So what were the two core antibodies? Try to remember. These were IgM and IgG. IgM was the marker of early phase, so acute phase. Which core antibody will appear? IgM. Chronic infection, what is the marker of chronic infection? The marker of chronic infection is IgG. IgG. So I think that will be enough for today. I hope you all have understood what I tried to teach you. If there is something which you haven't understood, you can comment it in the comment box, and if you have any suggestions, try to give those suggestions. I will surely read them. And if you want further videos on different medical topics, post in the comment on what video you want the on what topic you want the further video. Thank you.